Good morning all, hope you can hear me in the back. All set? Awesome. Well, thank you for joining us this morning. Good to have you here. The topic for today is HIPAA-Safe decisioning for the digital front door and patient experience. Quick intro about us. I'm Ramal Vemana. I'm Principal Product Specialist for the Healthcare and Life Sciences vertical at Telium. What is Telium? Telium is a HIPAA-compliant decisioning and patient experience platform. I oversee product and strategy for the company. I am based in Philadelphia. The company, we've been HQ'd in San Diego for quite some time now. I come from the industry. I spent many years in the healthcare and life sciences world, consulted for IQVIA, worked for Merck, GSK, Pfizer, saw the patient engagement problem, whether it's on the data side or the software side, in a front row seat capacity. I'll let my colleague Patrick introduce himself.
Hello, my name is Patrick Franco. I'm a solutions consultant with Telium. I work very closely with Ramal in the healthcare, life sciences, and pharmaceutical vertical. I've spent the last 7 years in technology consulting and am excited to be here and present to you guys today.
Awesome, let's get rolling. What's today's agenda? We're going to take a little snapshot of where HIPAA compliance and HIPAA as a set of privacy rules and laws has been in the past few years. We'll talk about the OCR bulletin that came out in late 2022, how that changed the game around tracking and patient experience in general, the ramifications of which we are still feeling today. And then the gaps and challenges fast forwarding to today. How we have lost the ability to measure things across the patient journey, whether it's a campaign that drove the patient to your front door, whether it is, for example, them experiencing friction while trying to make an appointment booking, or, for example, them seeing too long a wait time between booking the appointment and actually getting to see the clinician. These are all friction points, and these are happening across the entire journey. We have lost the ability to measure things along that journey. So we'll look into that. The inability to optimize media budgets. If you're not sure what media campaigns and what channels are driving traffic to your front door, you really can't optimize. You don't have the ability to understand which campaigns are actually giving you bang for your buck, as opposed to the bad campaigns that need to be suppressed and just gotten rid of altogether. That's yet another gap that we will be looking at. And high patient drop-offs, whether it's due to, for example, them coming across a required field they may not comfortable providing the information for during the booking journey, or the long wait time between booking and appointment and the encounter, that is causing high patient drop-offs in some cases. So we'll look at the causes and a peek behind the curtain around those drop-offs. And then there is the fragmentation problem between your front door and how you engage the patient. When they come there, they've made an appointment. Are they going to drop off? Are they going to stick to the appointment? How are you engaging them from the first click to the first encounter and beyond? There is a lot of gaps and data silos, as we call them in the industry, happening. That's creating a certain opaqueness when measuring, when engaging patients. We'll look into that as well. And then the solution for all of this, what is needed to address these gaps? That would be a HIPAA-compliant decisioning and experience platform that enables the following things. Insights you can act upon. Is there friction in the booking journey? Is there too long a wait time between booking and encounter? Is there consent challenges? Are campaigns actually performing? Are channels performing as you want them to? Those actionable insights should be at your fingertip for you to be able to optimize your operations and improve patients' health outcomes. And then the ability to create real-time patient experiences. Say, for instance, a patient is stuck. They've been spending 5-10 minutes, they haven't booked an appointment yet. Being able to intervene, being able to give them help in real time rather than them leaving the journey and hoping that they would come back and rebook and pick the journey back up. That wouldn't be the time to engage. You need to engage them in the moment, in real time. So a platform like this should allow you to do that too. And an engagement of non-patient stakeholders. If you think about driving revenue, if you think about improving care access, referrals are a big component. There may be recruitment efforts within your organization. Those stakeholders need to be engaged as well. The beauty of such a compliant, foundational decisioning and experience platform is you can engage even the non-patient stakeholders. That way you have that Swiss Army knife, so to speak, when it comes to stakeholder engagement that goes beyond even patient engagement in many cases. And then we'll think about the way forward. We'll talk a little bit about Telium, about how we've been solving our healthcare customers' problems over the years.
All right, so at the end of today's session, what do we want to walk away having learned? Firstly, where fragmentation, so the fragmentation caused by different data silos is limiting visibility, growth, and operational performance. How this data foundation that is created through breaking down silos will connect marketing, access, appointment, and encounter data into a single decisioning and patient experience layer. How this unified data set supports conversion, time to appointment, right? We're trying to widen the funnel as much as possible, reduces no-shows, and increases patient satisfaction because they have an easier path to conversion. And finally, how that same data foundation can support referrals, donor engagement, and patient-adjacent growth initiatives that may or may not also be covered under HIPAA. We're going to take a look at what the architecture considerations are and the types of characteristics of this architectural pattern that the platform that we're going to talk about will enable and what you need in order to create these experiences.
Awesome. Okay, so I promised a snapshot of HIPAA and the landscape around HIPAA and the compliance efforts over the past few years. We'll start there. All right, so 2022, late 2022, the bulletin comes out from OCR, creates sort of an earthquake. It was a tectonic event, for lack of a better expression. All of a sudden, the definition of what qualifies as protected health information, PHI, has changed. All of a sudden, we're talking things like IP address and the intent to seek healthcare rather than even simply focusing PHI on existing patient-provider relationship. All of a sudden, the data you were collecting safely, securely, became sensitive. So organizations had to adapt. They were caught off guard, but they had to now evolve and catch up. And in 2023 to 2024, organizations started responding. Many of them, the immediate short-term reaction was to remove tracking from their websites, the mobile apps altogether. Things like GA4 out, Meta, anything that wasn't HIPAA compliant. In many cases, even somebody who was HIPAA compliant, out. Complete loss of visibility, flying blind. And then eventually organizations started, many of them, if not all of them, started investing in technologies that enabled that sort of HIPAA compliant collection for analytics and operation purposes. This could be, a technology that helps you de-identify PHI, remove any of your 18 plus personal identifiers and render the data safe to share with a non-HIPAA compliant vendor. So organizations started investing in technologies of that sort. And then 25 to now, where we are today. Many or even most organizations, they've become HIPAA compliant to some degree, at least from an analytics and operations standpoint. But there is more work to be done because this has created an abundance of blind spots and gaps, which we will get into shortly. Diving into the analytics problem a little bit. So how did organizations tackle it specifically? Most organizations followed one of three approaches. As I said, removing all tracking completely, right? It's great, it's brute force approach, but it gets you compliant right away. But the disadvantage is no ability to understand user traffic, where traffic is coming from, what pages are being navigated, what's the funnel looking like, etc. And not able to calculate website performance and marketing ROI, which campaigns, which channels, nothing, no visibility at all. The second approach is de-identifying the health data and removing sensitive elements before sharing it with non-BAA analytics vendors. So these technologies do exist. What that does, however, is it reduces the fidelity of the data you're able to share with a downstream non-compliant vendor. It could be GA4, could be some other analytics partner, offering you a cheap or even free analytics solution, but you're not able to share the full fidelity of what you're collecting from your patients because they're not HIPAA compliant, and OCR prevents you from sharing the full view of what you're gathering. Only de-identified data gets through there. The advantage of that is, of course, it's HIPAA compliant, but the disadvantage is reduced accuracy in the insights you're getting out of these analytics platforms because it's the insight quality is limited by the quality and the fidelity of the data you're putting into it. Last but not least, using analytics vendors that include a BAA, or even using homegrown analytics tools. Like this could be Power BI, this could be some other solution that's a SaaS provider. The challenge with that is a lot of these point solutions, they do one thing and one thing only, which is analytics. In our experience, that is, in many cases, a bit too much for what our healthcare partners need. The tools are very powerful, but they come with a lot of bells and whistles. You don't need all of the functionality when you're looking for basic digital insights. And in addition, you still have to move the data around. Your data is sitting in, for example, your website, a mobile app, or whatever. You still have to figure out a way to either ETL or create a file export and then a file import to move data around to make the most of these dedicated, what we call point analytic solutions. So the immediate impact of the OCR bulletin is obviously the ability to share data with analytics vendors was severely impacted. You had to come up with one of those three approaches we talked about earlier. And you can't share PHI with vendors without a BAA. And the most popular cost-effective solutions, they don't include a BAA. And hence the data fidelity problem, due to you having to sanitize the data, make it less sensitive or even make it completely not sensitive. And then the loss of insights limits the ongoing measurement and optimization, whether it's patient engagement, experience, marketing, whatever it might be. If you are having trouble either getting the insights from these free solutions or don't have the IT bandwidth or the know-how to move the data into a compliant analytic solution, then too your quality of insights you're getting out suffers. So what are the outcomes of all of this when all is said and done? All right, so you've invested in one of these solutions. What happened? The HIPAA compliance risk has been reduced to some degree, one way or the other. At least you don't have regulators threatening you with any legal action. You've become compliant. However, this has led to many, many inefficiencies. For example, analytics, especially digital analytics, is often incomplete because you are sharing that low-fidelity data I mentioned earlier with non-BAA vendors. And then the compliant analytics vendors are expensive to set up, to procure, to onboard, to move data into and out of all of the complicated infrastructure requirements. You have to go through your InfoSec process, the whole kit and caboodle. And no visibility, despite all of this, into the complete patient journey. You're spending months and years trying to achieve compliance. What does that get you? Your patient journey is still very fragmented, very disjointed. You have your CRM, you have your EHR, you have your website, you have your some other smart device, depending on your organization's infrastructure. They all are talking to only themselves, but not talking to each other. Patient call center by call center, there may be no context, even though the context is known to your infrastructure. That particular touch point doesn't have the context. Why are they calling? Who are they? Where are they calling from? What were they doing right before they, for example, did click to call? All those contexts are, despite being known, are not actionable. They're not activatable, shall we say. We'll double click on the gaps a bit more closely. All right, so first obvious gap is that loss of measurement and visibility across the journey we were just discussing. And then the inability to optimize media budgets. Is campaign on, for example, Google performing better than Meta, than LinkedIn, than some other channel? For example, is organic search working better? Or is it context-based search when they go in WebMD, for example, and searching for osteoporosis symptoms, for instance? Which channels are performing? Not able to measure because of that inability to bring the data together and not able to see the data through. Suboptimal patient experience. The call center example. Even though you know who the patient is, the agent taking the call may not know who they are. The patient feels frustrated. They may be having trouble. They're in a bad mood. They're in pain. Just making the experience easier, just meeting them where they are, depending on where they are, would go a long way in improving patient experience. So that's a gap today. And then the disconnect between the digital front door and the patient engagement piece. The patient made an appointment, but who are they? Are they likely to churn? Are they likely to just drop an appointment? If it's 6 months out, will they show up? Likely not. But nonetheless, there is that disconnect that's preventing you from seeing where this patient came from. Are they a current patient? Are they having any friction in booking appointment? Are they having any friction showing up for the appointment that they booked, et cetera, et cetera? That disconnect is making things complicated, creating further blind spots. All right, so let's take gap number one, loss of measurement and visibility across the patient journey. So this is typically what a journey looks like for a patient. They are going to a website and they go into the portal, they click on the website. For example, maybe you're using MyChart in your organization if you're a provider. And when they click on book, they take into the portal where they log in, they make the appointment, they actually do the booking, and then comes encounter, and then follow up, et cetera, and the loop goes on. But think about all of the data and all of the insights and the different streams of information being generated in each of these touch points, in each of these steps. During the website visit, they are giving behavioral signals. How long they are spending on a page. How long do they spend on the site? Which pages are they looking at? What campaign are they coming from? That data is all sitting within the website visit data silo or discrete data point, a discrete area. And then in the portal visit, they're logging in, they're searching for appointments, they're abandoning maybe scheduling flows because it's too complicated for them. They're not finding, for example, they're having to click through 10 providers and they haven't found anybody in their zip code with availability that they would prefer. They've abandoned it. That information is sitting within your portal, not accessible to you readily. And then which providers are they looking at? Where are those providers located? What specialties are these providers? And so on. And then they finally book. Now we have the appointment creation information, the provider that they selected, the information on the appointment, the booking channel, call center, whatever it might be. Do they cancel? Do they reschedule? That is sitting in yet another data silo. And then the actual encounter. Now did they show up? Did they not show up? The diagnoses, the procedures they underwent, what prescriptions, what notes did the provider leave for the patient, etc. That data is also being generated during the encounter. And then in the follow-up, what happens after the visit? Lab results notifications, any preventive service reminders, any transportation help and assistance, any readmission that's going on, patient satisfaction survey, how did the patient like the service? Are they likely to return to see the provider or the system itself, etc. So what's missing is while the patient is going through all of these journey points and generating all this data, all these insights, you're not able to connect them all together in a single thread. There is no end-to-end visibility from the first click to a first completed encounter, the follow-up, and beyond. There is no closed-loop reporting tying acquisition to outcomes. For example, which channel, what drove them to your digital front door? And then, did they actually convert by becoming a patient? Did they convert by booking an appointment? So you have your booking happening here, but you're not able to see, did booking actually lead to a clinical encounter? You're not able to see that today, because some data sitting in the EHR, when they leave the website and go to the MyChart portal or whatever patient portal there is no connection. They come in as an anonymous visitor. They make an appointment as a known visitor. But how do you know how many of the anonymous visitors actually became patients? You can't see that because those informations are not tied together today. The result is limited insights into where and why patients drop off. The inability to connect intent to care delivery. That's yet another deficiency because of that. Unable to optimize content marketing and experience channels. I mean, how wonderful would it be if a patient is clicking 10 providers, they still haven't booked anything. They've already provided the zip code, maybe a specialty. How nice would it be for the patient for you to quickly pop up, looks like you need assistance. You selected the zip code. Here are 10 providers with the specialty you selected that have availability today or tomorrow, next week, next month. That is personalization. You can't do that when the data and the insights and the actionability is sitting in different points within the journey. Gap number 2, media budget. So what's happening? Marketing spend is disconnected from actual outcomes, whether that is booking or encounter, follow-up, whatever it might be. You're spending money on campaigns. They're coming to the site, but then what happens beyond that? We don't know. Again, because of the website data and the EHR data and the call center data all not talking to each other. Campaigns are measured in clicks and form submissions, but not actual completed encounters, and that's a big blind spot. It's hard to tie revenue back to media source or channel. What actually drove traffic? Which campaigns are actually leading to a patient showing up? Are we targeting the right zip code? Are we targeting them with the right creative, in the right context? No visibility around that. So what's missing is the booking and encounter level ROI reporting. How is your service line performing? You can't see that. There is no visibility into that. There is no unified reporting across your media, CRM, and EHR channels. The result is your media budget allocation is simply based on clicks, which is not complete. You are doing it based on Certain signals, but not the ones that matter the most, always. Overinvestment in low conversion sources, more often than not. Underinvestment in high value acquisition sources. That's yet another problem. When we say media optimization, it's about suppressing the poorly performing campaigns and doubling down on the nicely performing campaigns as much as possible.
I would also add on the previous slide
Yeah.
as well. Maybe today measurement or attribution is done at the campaign level, but it's limited to a view of pre-acquisition, right? How much did I spend to get this person to ultimately convert? As we saw in Gap 1, when we think about what happens after the individual converts, if we're able to tie together the entire journey, we're not only able to optimize media budgets, but then we're also able to understand and attribute the lifetime value of a customer to every single dollar spent upfront to acquire them, which from many of the conversations that we've been having in the space with different healthcare organizations is sort of like an executive level directive. They want to understand, right, how the money they're going to spend today ultimately impacts revenue driven down the line in the long tail. So I think that this one could even be taken one step further to kind of expand right out and understand what the impact of media is today, but in the future state.
And the beauty of that is, you can tie an unknown visitor landing on your website all the way to them showing up and the lifetime of that patient. How long have they been having a relationship with the organization? Does it go back 5 years? You can tie all the way from their anonymous behavior now to an ongoing provider-patient relationship today. So suboptimal patient experience, we talked about this to some degree. What's happening today? Patients encountering friction. For example, maybe asking for the payer information as a required field is putting certain patients off. They would like to book the appointment, but due to that one specific required field, they're just dropping off. It's too much friction for them in the moment. They're dropping off. Limited personalization despite patient context being known. The call center example. Patient is, for example, has spent a lot of time trying to find a provider. They're calling, they're doing click to call to get help, rather than them being routed through 3 different departments. Based on that context, you can simply transfer them to the right person. Or even, for example, I see that you have been spending some time on the website, looks like you need assistance. Would you like to see a cardiologist, for example? Like that sort of conversation is personalization. That's not happening today in most cases, in the vast majority of cases. Interventions to reduce drop-offs, that's not happening either. If you think this patient has a history of poor appointment adherence, then if they have an appointment coming up, rather than simply sending them a simple reminder, send them something a bit more personalized. The benefits of getting regular checkups, the benefits of actually having an annual clinical visit or a specialty visit, whatever it might be. That is intervention that would speak to them rather than a generic reminder that says, you have an appointment coming up in 10 days, please don't forget. The result is increased booking flow abandonment and appointment no-show risk, obviously. The more friction they encounter during booking and post-booking, increased likelihood of them not actually completing the visit. Longer time to appointment. If, for example, they have 2-3 months out, they can't see a specialist, but what they don't know is there is another specialist within their zip code. Maybe they're 5 miles away rather than being 2 miles away. Them not knowing that would lead to them abandoning the appointment if they think the time to appointment is too long. What they would do is they would grab the appointment, they would simply try and find a specialist in another network and then drop this appointment, leading to abandonment. So barriers to care and treatment, that's what it all adds up to. All this, the data silos, the data systems not talking to each other means the barrier increases, you're not able to see the patient better, which leads to them feeling friction and them dropping off. Gap number 4, the fragmentation problem. So what's happening is the point solution we alluded to earlier, website, chat, call center, they're all siloed. They all do what they do very well, but they're not talking to each other. So the context in one channel remains exactly that channel-specific context, not cross-journey context. Inconsistent engagement across channels. Patient calls in call center despite having been a patient for 10 years, but they may get service like as if they are a new patient who hasn't even made an appointment. That is not personalization, that's not contextual. So that's inconsistent. Depending on the channel they're engaging in, it's stop and start quite a bit. You don't want that. Unable to optimize and scale experiences along the patient journey. Every touch point should remember who the patient is. If they are encountering friction, Chatting with an agent, the agent should know where they are. If they have an appointment coming up, the patient is calling in, or receiving an email, that email should take that into account. What's missing is that holistic view of patient across touch points. There is no centralized or consistent decisioning or patient engagement mechanism that understands where they are and then engages them accordingly, the way they want to be engaged. The ability to respect and act on the patient communication preferences, emailing them when they would prefer receiving a text message, when you know that they are more responsive to, for example, a call rather than an email. All of those preferences and consent and whatever the patient has provided in terms of their communication preferences and dislikes should be honored and respected. The result of not doing all of this is operational inefficiency, a disjointed patient experience. Again, the call center, email, everything is different when they're engaging with it, and decreased patient satisfaction as a result. Patients don't feel heard. They think it's too cumbersome to make an appointment and actually show up. So what's the business impact? What does this loss of journey visibility, the inability to optimize your media spend, a suboptimal patient experience, and the fragmentation between your front door and the patient engagement ecosystem, what does it all add up to? Increased cost of patient acquisition, obviously. Lower booking conversion. More friction means fewer bookings or even fewer booking to appointment conversions. Longer time to appointment, obviously, and decreased patient satisfaction. And the inability to scale your marketing initiatives, your operational initiatives, your patient support initiatives at scale, which means less ROI with your entire ecosystem, whether it's marketing or tech or your patient support, professional services, whatever it might be. So what's needed? Patrick will get into that.
Thank you, Nirmal. All right, so we're going to talk about, yes, what is needed in order to overcome the gaps that we just reviewed. Some of these requirements are going to be architectural, some will be related to different capabilities, as well as speaking to kind of the structure of the data itself, right, that's going to power these experiences. When we're thinking about what are kind of the general architectural requirements for actionable insights, we need something that is going to be interoperable across the tech stack. Every single different healthcare organization that we work with has a unique technology stack. Some use Invoca, some use CallRail, some use Five9, some use Epic Cheers, some use Salesforce Marketing Cloud and Salesforce CRM. All of these systems were not necessarily designed to speak to one another, particularly the large cloud platforms like a Salesforce or an Epic. So in order to create this unified kind of view, right, of the customer journey, we need something that is going to communicate across all these applications and create what we otherwise might call a data fabric. And through that data fabric, we eliminate the silos. 2, we need the ability to act on any of this information that is found in these applications in real time. Good example earlier was web personalization. You can't wait 10 minutes for somebody to have closed their browser to try and get them to book or convert. You need to be able to push them, right? Shorten that funnel in that moment and act on the intent signals in the context that the user is providing there, not only on the web channel, but also maybe from other channels where they had previously interacted. So in this way, the ability to orchestrate these real-time cross-channel experiences are going to reduce friction and expand access to care. Critically, in parentheses where it says, while respecting communication preferences, I think that this is a challenge that pretty much every health system we speak to has, where consent, and we're talking about marketing and communication consent, right, not treatment consent, lives in different systems. Maybe it lives in CRM, maybe it lives in EHR, but you're unable to act on it if they're on the website. You don't know, right, what they've consented to, therefore limiting your ability to engage the user in that channel. So we need a way to respect and honor those communication preferences. And lastly, we're going to talk about, right, how this data foundation, this approach, both with respect to the data, the architectural pattern, its requirements, its capabilities, can also extend to engage non-patients, such as donors, physician referrals. We work with many health systems, right, that are looking to drive donations from different segments of users that come to their different channels to make those donations. So how do we interact with them and get them to come back and continue to donate, as one example. What we're gonna do now is illustrate those requirements that we previously saw through different use cases. These use cases are real-world use cases that we've implemented for other health systems, and they're going to kind of bring to light the approach that we're talking about here. First, unified actionable insights. What does this mean when we say unified? We're talking about the ability to collect, persist, and analyze attributes with respect to media campaigns, different channels, traffic sources, and then be able to triangulate that with service line insights. What are people who are coming through my organic versus paid search ads, what are they looking for? Are they interested more in pediatrics? Are they interested more in cardiology, for example? How do we understand the different kind of user flows with respect to user segments? We want to be able to tie that obviously to the conversion events themselves, appointment funnel and bottlenecks. So where are people dropping off with respect to the service that they're looking for? And then ultimately we need to tie that to the other side of the funnel. It's almost sort of like a bow tie, right? We have pre-acquisition, funnel is wide, we acquire conversion, and then after they convert, we have to understand which of those folks that converted came to their appointments. What happened after, right? They ultimately made that conversion event. Did they show up? What kind of follow-ups do we want to basically drive from those users to increase their lifetime value? So an example of this, if we're going to kind of tie together now the architectural requirements with what we're trying to accomplish with insights, on the left-hand side of the screen, we're talking about those different data silos, those different data sources. From each different data source, it's going to provide different context with respect to the user. Maybe on the hospital website, we have the browsing and campaign data. What was the entry channel, the entry source? What web pages are they looking at? Comms preferences tend to live in a CRM. EHR has that appointment data. For this individual, this platform, ideally what it's going to do is unify data from these sources with respect to the user and understand who that user is. We're going to see an anonymous example here momentarily, but in this case, we're looking at Annie. She is known. Annie came to the website. She viewed certain service line pages. She clicks to book the appointment. She enters the scheduler. She selects a slot, completes the booking process, but she no-shows. What are the types of insights that we could derive off of, again, unifying these different kind of actions that Annie's taking, but in all these different channels? We could suppress ineffective channels or campaigns. We can reallocate media budget to different buying strategies that lead to people showing up to their appointments. Maybe identifying a trend, right? Why are folks not showing up with respect to a particular care type? The business outcome, right, of deriving these types of insights is you're able to just act more intelligently. Marketing spend optimizations. You're also achieving communication compliance, which varies by state. Those are going to be the outcomes of these types of insights. If we take this one step further, and this is a great example from a health system we were working with where they were trying to understand where the fall off or the bottlenecks were with respect to conversion. And what they found out was, as you can see on the right-hand side of the screen where it says, make insurance member ID field optional, that is what they did. They changed basically the data input requirements of the scheduling flow. And what they found was that increased the number of conversions that people were signing up for primary care appointments in their example.
By 35% in this particular example, just by removing one field, number of bookings went up 35%, which is significant for such a small little tweak on your website.
Yeah, right. But not significant to the user. I mean,
exactly.
I don't insurance member ID. I would have to go hunt that down, find my insurance card, forget my login to my insurance portal, or any other portal online for that matter. In this case too, we're talking about the integration of contact center, so call center outcomes. By understanding, right, for example, if somebody is going through that scheduling flow, and all of a sudden, maybe they hit that insurance member ID field and they don't have that value, they can't put it in. They click to call. Ideally, this platform will orchestrate this user's data directly to that call center agent. So that way they understand the context of what they were doing on the website in that moment in order to, again, shorten and widen the experience or the funnel to that conversion. Let's talk about patient experience. I just kind of alluded to it, right? We talked about removing the member ID field, talked about delivering contextual data to call center agent to improve that experience. What we most commonly see is, again, this unified profiling of the individual across web, portal, call center, CRM, cross-channel personalization, so personalizing in those individual channels, and then being able to, based on what that user is looking for, intelligently route or do some sort of capacity-aware personalization, like Nirmal said earlier. For example, if somebody puts in their zip code, maybe there's no capacity at the next closest location, go ahead and personalize the experience and say, hey, here are the 10 providers that do have capacity that are the next closest to you. If we look at some of these patient experience examples, we can think about someone that we might call the indecisive patient. In this case, they are unknown. Ideally, this platform and approach that we're talking about allows you to persist contextual information on unknown users. In the way that this is done is through assignation of an anonymous ID, which is inherently HIPAA compliant, right? We don't know who they are, there's no PII. But we're continuing to persist the contextual signals and intent signals that this user is providing. In this case, what we did for the health system with this anonymous web personalization was simply trying to route people based on what they were doing in previous sessions. So maybe I've been anonymous, I've visited the site 3 times in the last week, I spend 5 minutes on the site, I look at some pages, and on maybe my 4th visit I come back, right, and we display a message, still undecided, here are the 3 recommendations we can make that are related to what you were last searching. Call center personalization is another great example that we see very frequently. I alluded to it before. In this case, we're talking about delivering the contextual information of the user from a digital channel to one where they're interacting with a human. You can see the outcome on the right is call center agent is equipped to have a conversation such as, I see that you started a heart health risk assessment. Are you interested in finding a specialist? One of the things that I want to call out as well is with respect to the data sources and how all the health systems we work with have different tech stacks, right? And different approaches to managing prospects, health risk assessments, all the different kind of like micro funnels that they're using to build awareness among these different patient segments or potential patient segments. We want to make sure that the platform itself allows you to build effectively a data layer that is representative not only of patient context, but is in the terms of the health system, the terms of the organization, of the business. And in that way, we can basically do this sort of extensible data sharing with other platforms like a call center, creating that full kind of data fabric, as I said in the beginning, where from front-end applications where users are engaging to back-end, these systems are able to communicate with one another in real time based on triggers like patient clicks to call, number on the homepage. So what does this look like if we were to kind of show all of these use cases occurring at scale? That's what you're seeing on the screen here. We have all of these different kind of journeys that individual users are taking as their profile is updated. It's enriched with the newest context married with the historical. Some people refer to it as longitudinal and latitudinal data. The historical data comes from places like a CRM or an EHR. The real-time data comes from places like a mobile app or a website. We marry that together to understand what is the relevant state of the individual, what is the context, what are their signals, and ultimately individuals can move in and out of different audiences, in and out of different segments based on that state. This process ideally occurs in real time, so we can do cross-channel personalization. And ultimately, as these users move in and out of different segments, that is the decisioning that triggers the experiences. If we were to tie this all back to the analytics points we made in the beginning, you can see the business outcomes on the right. Those are suddenly now measurable, whereas they were not before, because we have this single unified view of the patient, their journey across the different channels and the technologies. So this sort of brings us all full circle, right? And if this is an automated decisioning process, we're able to do this at scale. And that is truly the value of this approach that we are talking about. Lastly, you can imagine, maybe we're not talking about patients, maybe it's donors, maybe it's physician referrals. What we just saw in the previous slide applies to these non-patient segments as well. So the ability to define and understand and identify if someone is a patient versus a donor, or are they a physician referral? Kind of compounding the value, right, of what we're talking about.
Well, hopefully that made sense as to what the gaps are. Hopefully the gaps resonated with you, and the solution we are seeing our customers derive value from, you would find helpful as well. Hopefully you derive some of those insights today during the session. We would like to wrap up by talking a little bit about Telium. Obviously, that's why we're here. We work for Telium. So who is Telium? We are a leading enterprise-grade data platform. We are that HIPAA-compliant decisioning and patient experience platform. We have all of the HIPAA high-tech attestations by individual third parties. So it's a trusted platform. We sign a BAA for our healthcare regulated customers who are covered by HIPAA. And you can collect the data, and we will give you the written assurances and the guardrails and the technical safeguards to make sure the patient data is protected within the platform. And you can essentially safely send that data, make the decisioning, and create the patient experience that your patients really want, they've come to expect, because they act like that digital consumer where they bring the same mindset when seeking and acquiring healthcare as well. We enable healthcare interoperability, whether that data is sitting in the call center, whether you would like to track appointment booking to conversion to encounter, post-procedure complication, whatever it might be, the data that's sitting in EHR, wanting to tie that to which campaign drove traffic, or who they are speaking to within the call center ecosystem. We provide all of that healthcare interoperability. To us, EHR, CRM, data warehouse, web, mobile, whatever it might be, they can all talk to our platform, which means you have one central place to make your decisioning efforts a reality. And why do healthcare organizations choose Telium? We provide the real-time data collection capability, that sort of personalization that Patrick talked about. Would you like assistance? We see that you are struggling to find a provider of your liking. To be able to engage the patient effectively, you need the real-time orchestration capability, and that's exactly what Telium does. Rather than you having to email the patient after booking, after the fact, after they've even abandoned the appointment. And then, what does that mean? What KPIs and what metrics does it help you drive? It increases appointment bookings and also conversion. It helps you decrease time to appointment on the patient. If, for example, patient booked an appointment that is months out, you can make other suggestions. Here is a provider who is slightly further out. Would you like to book them instead? Again, not expecting the patient to come back and stay loyal to you and then find an earlier appointment, but rather intervening in the moment when they have just booked an appointment that's months out. That's pretty powerful from a patient's point of view. So that does lead to increased patient satisfaction. And the non-patient stakeholder engagement means you're improving physician referrals, you're improving donor engagement. If you want to, for example, direct traffic that comes to your site to an employment page or a patient or a specialist page or a service line or a donor page or referral page, you can do all of that in real time to essentially give your target stakeholders the optimized experience that they would be looking for. And then that gives you increased ROI on your operational technology investments, whatever data partners you have, whatever technology investments you've made, whatever marketing campaigns you're running, everything becomes optimized, leading to increased ROI. Next slide, please.
Excellent. To provide kind of a 10,000-foot view, right, end-to-end of what the platform is able to provide, we have data sources on the left. Those data sources are able to feed information to Telium. We are able to collect data from these different sources in a HIPAA-compliant manner. We have all sorts of different ways to do this. We have a tag management solution. We have server-side data collection. We have hundreds of APIs and plugins that are turnkey out of the box. Integration for data collection is one of the, I would say, strongest capabilities of the platform. And the reason why that makes a difference is because we talked just on the last slide about operational and technology investment. Having something that's agnostic to any other walled garden or system, there is obviously long-term return on investment implications when you're able to change your tech stack and not have it impact the end use cases like patient experience and analytics. As Telium collects this information, we have an event layer, we have a profile layer, we have an audience layer. This means that data at these different kind of levels, right, or scopes, can be orchestrated, managed, governed in such a way that it remains compliant while still enabling the use cases. We understand that things like web personalization might be triggered by an event. Call center personalization might be triggered by the enrichment of a profile. And then if we think about marketing strategy from like more of a group or cohort level, we need to be able to group people into audiences and then activate whether they enter or leave those audiences. Underneath all of that, you can see where it says full funnel channel and journey analytics. You're able to analyze data directly within the platform. or integrate it with third-party BI applications if you want to as well, to better understand, right, again, at the event, profile, and segment level, what are those individuals doing with respect to the channel that they're in and with respect to conversion and lifetime value. Obviously, this is all kind of underpinned by different governance, administrative, and technical safeguards that allow us to be HIPAA compliant. And on the outbound, as you can see on the right, we connect with any marketing channel, any kind of experience channel, in order to go ahead and provide that patient experience. The last part I want to call out is where it says update CDW and EHR on the right-hand side. Despite the fact that today we've been talking a lot about patient-specific use cases, many health systems use our platform to drive efficiencies within their existing tech stack, and do so by being a data management or data fabric platform, where we're able to reduce compute costs, for example, in places like AWS or Google, by being the router of this data. So the benefits of this platform and an approach extend beyond simply the patient experience. I want to call that out because it does matter for the technology and operational ROI we were talking about before.
And these are our current customers. The logos speak for themselves. They stand by us. They love our product. Many of them have been customers of ours for many, many years now. So just leave it there.
All right.
Questions to incentivize. If you have a good question to ask, you get this tote bag. There's a little doll, plushy doll, and some sweet treats as well. We know how to get people to engage, so feel free to ask any and all questions. Will be here, even past the session close. There is a mic over there if you care to come up, or you can speak up from your seat as well, whatever's comfortable.
Yeah. All right. If there are no questions.
Let me ask you this, are these gaps resonating with the audience, with you? Are you able to relate to them?
Yeah, they're definitely related, and especially with not just HIPAA, but if you think about compliance laws with GDPR and stuff that have gone back to 2018, 2020 and things. I think one of the challenges that we encounter is how you guys were talking about that first click to last click or first click and beyond. And so how have you worked with clients? Because I feel like one of the challenges that I've seen with companies is they'll just be all about the first click attribution.
Mm-hmm. Yes.
And then as you talk about the patient experience, so okay, the email campaigns went out. So the email campaign, so they'll look at the email campaign performance, and then they'll kind of attribute it to the end goal, the revenue volume or the booking volume or something. And so it's almost there is some truth to that attribution, but it is more of a correlation, because in between that email and all these other touch points, they called the call center, they visited the patient portal, right? All of that helps orchestrate that end booking or revenue. Mm-hmm. So how have you worked with organizations to, one, get them to understand that, and then two, put in a framework that helps give that more multi-model attribution? Mm-hmm. I don't know, any key learnings or insights, I guess, on that?
Absolutely. I would start with saying, first of all, you don't need to understand who the patient is to create a personalized experience where they feel this organization gets my pain. So that's key for them to convert, right, to make an appointment. So that's an important point. The blind spot there is today, and this is a problem we keep coming across all the time. They come to your site. When they click they start the booking process, it takes them to another vendor's ecosystem. Could be Epic's MyChart, could be Oracle Cerner, or whatever it might be. So there was a blind spot there. Yes, the same person clicked away and they made the appointment. It seems you just have to track that person to the person that made the appointment. But that's a technical problem that's not so easy to solve. Yeah. We have solved that through technology by partnering with vendors like Epic, with Cerner, etc. Now you can essentially tie an anonymous visitor that came to your site to the appointment they made, to the call center call they made, the email they received, everything. So that first step is the major unlock. And the good thing about Helium is you can track a patient across any identifier they are using in a given channel. It could be their phone number, it could be their email address, it could be a cookie ID, whatever it might be. So by being able to tie that all together to a single individual, that is how that end-to-end attribution happens. So I think that's really our bread and butter in what we do.
I would add to, as far as key learnings are concerned, one of the things that we started to understand or recognize after back in, 2023, whenever the newest OCR guidance came out, and folks started removing tracking tools, obviously, or kind of limiting attributes that exist in the data layers of these different systems. So, for example, big health system in Texas, I'm pretty sure the only event attribute that they track is like page name. And it's really hard to do any analytics, right, if all you got is page name. So what we started to figure out was like, okay, what are some of the universal data layer requirements that you need in order to connect the dots across the channels? And over time, we actually kind of productized a service offering, which was, if you want to do multi-channel attribution, this is the recommended data layer that you might implement on your website or on your call center. So a little bit more tactical and kind of getting gets us into the weeds. But what we found was that a lot of health systems didn't have the data points in the first place to even do the analysis. So making it easy for them with our platform to either define those data points, collect them, declare them, and then provide recommendations based on what we've seen for that whatever that specific channel is, and maybe even that specific vendor, because we work in other industries that might use someone like Invoca or CallRail. So that's kind of, as far as learnings, what we took away was, hey, a lot of health systems need to help with just understanding the data layer requirements for attribution in the first place. Yeah.
Thanks, guys.
No problem.
So I have a question about customer lifetime value. So we are a multi-specialty practice where our customer lifetime value is very different among specialties. And so when I'm trying to allocate budget, attribution is so key, right? Mm-hmm. Because I could spend X over here and my lifetime value is wildly different. Does your platform offer the ability for us to discern that level of data by specialty, by customer lifetime value of that specialty to the attribution?
Yeah, you absolutely could build basically the rules of the attribution model itself. So for example, if a user converts in a particular specialty, you could directly in the platform with your mouse basically set up a rule that says increment customer lifetime value when maybe certain events occur. So you would put that new kind of derived lifetime value attribute that would go in the user's profile. So you define those data points that you would need and the rules for when they're enriched or increased or decreased based on specialty, the activity that the user took, what channel they were in. However, you have your own probably definition of how value increases or decreases based on the user's actions. Once you define those inputs and they live in the profile, you absolutely can analyze, change over time among all users of that specific service line. Of that specific service line with respect to web or call center, you can basically define the dimensions of the analysis however you'd like. You can do all that directly within the platform, and you don't need to code anything. That's sort of what makes it so powerful. As a business user could say, hey, lifetime value should increase when these conditions are met, and now I want to analyze everybody who has those same conditions. Let's see what they look like and what the change has been over time. Yeah, no problem.
All right, if there are no other questions, thank you for joining today. We will be in booth 1320 on the second floor. Feel free to stop by if you have a question or anything you want to talk about.
Thank you, everyone.
Thank you for attending.
Appreciate it.